Greeting everyone. We continue our discussion on the topic of endocrine system. In this third part, we will focus our discussion on the subtopic of trophic hormone, non-trophic hormones, and non-pituitary hormones. Trophic hormones. What is trophic hormone? It refers to the hormones that have other endocrine gland as their target, or in other words, trophic hormone stimulate other endocrine gland or tissues to produce a hormone. And normally, trophic hormones being produced by anterior pituitary. So there are four strictly trophic hormone, which is FSH, LH, TSH, and ACTH. So what the function of FSH, or follicle stimulating hormone? FSH in male, it controls the production of sperm. Meanwhile, in female, it controls the menstrual cycle and stimulate the growth of eggs in the ovaries. LH, luteinizing hormone, their function in male, it stimulates secretion of testosterone. Meanwhile, in female, it stimulates follicular growth in the ovaries as well as ovulation. TSH, or thyroid stimulating hormone, it working or functioning to regulate the production of hormone by the thyroid gland. And adrenocorticotrophic hormone, or ACTH, their function is to regulate the production of hormone by adrenal cortex. Non-trophic hormone. What is non-trophic hormone? Non-trophic hormone refers to a group of hormones that directly stimulate target cell to respond or produce the effect. Again, non-trophic hormone we classify as a group of hormones that directly stimulates target cell to respond or induce the effect. And this non-trophic hormone also produced by anterior pituitary, which include prolactin, melanocyte stimulating hormone or MSH, and beta endorphin. What the function of prolactin? In general, prolactin stimulates lactation in mammals, but prolactin also has diverse effects in different vertebrates. For example, in certain invertebrates, prolactin regulates the immune system, and in other vertebrates, prolactin also working as a regulator for the blood clotting. MSH influence skin pigmentation in some vertebrates, and in other mammals, it working or functioning as in the fat metabolism. Meanwhile, beta endorphin, their function is to inhibit the sensation of pain. If you still remember, they are a type of hormone where we can classify as both either trophic or non-trophic hormone, which is growth hormone, or the GH. GH, or growth hormone, their function is to promote the growth directly and has diverse metabolic effect. And it also can stimulate the production of growth factors by other tissues. And it's also well known that GH can increase protein anabolism by increased amino acid uptake or increase protein synthesis, as well as decrease oxidation of protein. Non-pituitary hormone. Non-pituitary hormone is a group of hormones that are produced by non-pituitary gland. For example, thyroid gland, parathyroid gland, pancreas, adrenal cortex, gonad, which include testes and ovaries, and pineal gland. And normally, non-pituitary hormone well known as a regulators for various functions in the body, such as for metabolism, homeostasis, development, and also behavior. Thyroid gland. Thyroid gland, it consists of two lobes located on the ventral surface of our trachea, and thyroid gland produce two types of hormones, T3 and T4. Both thyroid hormone play a crucial role in stimulating metabolism and influencing development and maturation. If too little thyroid working or too little amount thyroid hormone being produced, that scenarios we call as a hypothyroidism, and normally it demonstrates by the symptoms such as weight gain, lethargy, and also cold intolerance. But if there are too much thyroid hormone, scenarios we call as or known as hyperthyroidism normally can lead to high temperature, high body temperatures, sweating, weight loss, irritability, as well as increment in blood pressure. And the amount of thyroid hormone being produced by individual can affected by can causes by malnutrition, and insufficient dietary iodine will lead to an enlarged thyroid gland, a disease we call as a goiter. This is the effect of hyperthyroidism, goiter, and another disease we call as a Graves' disease. And in human, it demonstrates by protruding eyes that caused by the fluid accumulation behind the eyes. Parathyroid gland. Parathyroid gland produce two antagonistic hormones, which is parathyroid hormone or PTH and calcitonin. Calcitonin, their function is to stimulate calcium deposition in the bones and also secretion by the kidneys so that it will reduce the amount of blood calcium. Meanwhile, in contrast, PTH has the opposite effect, which is it will increase the amount of calcium level. And it also has an indirect effect, which is to stimulate the kidneys to activate vitamin D, which will promote intestinal uptake of calcium from the food. Pancreas. Pancreas produce two types of hormone in order to regulate blood glucose, which is glucagon and insulin. Glucagon produced by alpha cell, meanwhile insulin produced by beta cell. The function of insulin is to reduce the blood glucose concentration, and the mechanism is by the first one, insulin will promote the cellular uptake of glucose, or maybe slowing glycogen breakdown in the liver and also promote fat storage. These three mechanisms promote cellular uptake of glucose, slowing glycogen breakdown in the liver, promoting fat storage will reduce blood glucose and stimulate by insulin. In contrast, glucagon, their effect is but to increase blood glucose level. The mechanism by stimulating the conversion of glycogen to glucose in the liver, and glucagon also stimulating the breakdown of fat and protein into glucose. Diabetes mellitus. Diabetes mellitus is a well-known endocrine disorder, and it causes by deficiency of insulin or maybe a decreased response to insulin in target tissues. Normally, diabetes mellitus demonstrate or marked by elevated blood glucose level. Diabetes mellitus we can divide by two, type 1 and type 2. Type 1, diabetes mellitus also known as insulin-dependent diabetes, is an autoimmune disorder in which the immune system destroys the beta cell of the pancreas, so lack of insulin. The second type of diabetes mellitus we call as type 2 diabetes mellitus, or also known as non-insulin dependent diabetes, and it characterized by a failure of target cell to respond normally to insulin. Insulin still being produced, but the target cell failed to take out the glucose from the blood, and blood glucose will remain elevated. Diabetes mellitus normally can be treated by either insulin injection or by using anti-diabetic drugs such as metformin. And there are a lot of symptoms of diabetes. Besides, we check our blood glucose concentration. It can affect the eyes vision and maybe our breath, a smell of acetone, and it also can cause gastric, urinary polyuria, glycosuria, where our urine contains some amount of sugar, and it also can cause weight loss and might affect respiratory system, or what we call as a hyperventilation. Adrenal gland is adjacent to the kidneys, and adrenal gland made up of two glands, which is adrenal medulla and adrenal cortex. Adrenal cortex produce a few types of hormones such as glucocorticoid, for example, cortisol, and cortisol influence glucose metabolism and the immune system. Adrenal cortex also produce mineralocorticoid such as aldosterone, where it will affect salt and water balance, and adrenal cortex also responsible to produce small amount of sex hormone, either male sex hormone or female sex hormones. Gonad, testes and ovaries. Testes and ovaries responsible to produce most of the body sex hormone, either androgen, estrogen, and progestin. Testes. Testes' primary function is to synthesize the androgen, and one main androgen is testosterone, where their function is to stimulate the development and maintenance of the male reproductive system. Testosterone, when being produced, it causes an increase in muscle and bone mass. That's characteristic of body characteristic in mature male, and it's often taken as a supplement to cause muscle growth, but it have many health risks, or what we call the side effect. Too much testosterone also they have some side effect. Estrogen, and the most important estrogen is estradiol, where they are responsible for the maintenance of the female reproductive system as well as development of female secondary sex characteristic. And in mammals, progestin also be produced by the ovaries or gonad in female, which include progesterone. What the function of the progesterone? To prepare and to maintain the uterus during pregnancy. Pineal gland. Pineal gland is located within our brain, and it produces a hormone we call as a melatonin. Production or the release of melatonin is controlled by the biorhythm. So what is biorhythm? Biorhythm is a cyclic pattern in the physiology or functioning of any organism. In this case, melatonin controlled by light and dark cycle. And the primary function of melatonin in most vertebrates, it associates with reproduction. It triggers for the breeding in certain species, especially the species in 4 seasonal countries. And in some species, it also triggers a behavior of hibernation. And normally, melatonin is released very high amount at night, and the amount released depend on the length of the night. If the night longer, it will increase the production of melatonin. With that, we conclude our discussion on the topic of endocrine system. Thank you.